This video contains information prepared based on the patient information leaflet to inform users of LATUDA. If you find this video helpful, don't forget to like the video, subscribe to the channel and turn on notifications. LATUDA belongs to the group of central nervous system medications. It is available in 20 mg, 60 mg, 80 mg, and 120 mg strengths in carton packages containing 30 tablets. The active ingredient of LATUDA is LURASIDONE. You can find the list of excipients in the final part of the video. What is LATUDA and what is it used for? LATUDA belongs to a group of medicines called antipsychotics. It works by regulating the effects of certain chemicals in the brain, such as dopamine and serotonin. In this way, it helps balance brain activity and reduce some psychiatric symptoms. LATUDA is used in the treatment of schizophrenia in adolescents aged 13 to 17 years, as well as in adults. Schizophrenia is a disorder characterized by symptoms such as seeing or hearing things that are not there, false beliefs, excessive suspicion, social withdrawal, and behavioral disturbances. These symptoms may improve with the use of LATUDA. How should LATUDA film-coated tablets be used? You should always use this medicine exactly as your doctor has prescribed. LATUDA should be taken with food. The tablet should be swallowed with a glass of water and taken at the same time each day. Grapefruit juice should not be consumed, and alcohol should be avoided while using this medicine. In adults, the usual starting dose is 40 mg per day. Your doctor may adjust this dose between 20 mg and 160 mg depending on your condition. In adolescents, the dose usually ranges between 40 mg and 80 mg. If you forget to take a dose, continue with your normal schedule the next day. Do not take a double dose to make up for a missed dose. In case of overdose, symptoms such as drowsiness, dizziness, movement disorders, and changes in heart rhythm may occur. In such a case, seek medical attention immediately. What should you know before using LATUDA? If you are allergic to the active substance or any of the other ingredients, you should not use this medicine. Using this medicine together with certain other medications may cause serious interactions. Inform your doctor if you are taking antifungal drugs, certain antibiotics, medications for HIV treatment, epilepsy medications, or herbal products such as St. John's wort. If you have heart disease, low blood pressure, a history of seizures, diabetes, liver or kidney problems, or if you have previously experienced side effects related to psychiatric medications, consult your doctor before starting treatment. This medicine should not be used during pregnancy or breastfeeding unless recommended by a doctor. During treatment, drowsiness, dizziness, and vision problems may occur. Therefore, caution should be exercised when driving or operating machinery. Possible side effects of LATUDA include the following. The most common side effects are restlessness, nausea, and insomnia. Other side effects may include dizziness, muscle stiffness, dry mouth, weight gain, drowsiness, and anxiety. Rare but serious side effects include neuroleptic malignant syndrome, characterized by high fever and muscle stiffness, severe allergic reactions, serious skin rashes, and blood clots. If any of these symptoms occur, seek medical attention immediately. If you found this video helpful, don't forget to like the video and subscribe to the channel. You can share your opinions and experiences in the comments section. Wishing you healthy days.